Subcommittee will come to order. This is our second hearing on the controversial decision by the Treasury Department to delay for 1 year President Obama's Affordable Care Act mandate, forcing local businesses to offer government-approved health care or pay a tax. Today, at last, we'll hear directly from the Treasury Department. What families and workers in my district are asking is this: isn't it unfair to grant business relief from the government mandate but still force average workers to comply with their mandate? If the President's health care law isn't ready for business, how is it ready for my family, my child, my loved one? And at its heart, both families and workers are worried and wondering, why isn't the White House listening to us? This isn't fair. The President has proclaimed, quote, "the law is working the way it's supposed to," unquote, and the White House, Treasury, and Health and Human Services continue to repeatedly assure the public everything's on schedule. But here's what's not on schedule. The Class Act repealed. The 1099 business reporting requirement repealed. Small business exchanges delayed. Mandate on employers delayed. The data hub behind schedule. Income verification postponed. Employer insurance verification delayed. This is the Affordable Care Act working the way it's supposed to? While the goal of the July 4th holiday blog post was to downplay the latest embarrassing admission of failure, it accomplished the opposite. It made clear Obamacare is not ready, nowhere near ready. And while the temporary relief from the employer mandate was welcome news, it didn't solve the serious problems our local businesses are struggling with under Obamacare. In fact, the President's health care law and its troubled implementation is causing more confusion and more uncertainty, which will continue to stop local businesses from hiring. Workers are seeing fewer hours and smaller paycheck. That's not fair. Businesses are struggling to find the money to pay for higher health care costs under Obamacare. That's not fair. Our neighbors are struggling to find full-time work, more than 20 million of them in America, and are finding fewer jobs to apply for. That's not fair. And now workers who depend on affordable health care for their families and loved ones don't get the same special treatment the businesses are getting from the White House. How is that fair? And just how are workers supposed to comply with the law? Federal law says that before getting a subsidy, they have to determine if you have an offer of affordable coverage that meets government approval. So are they supposed to contact their employer or their spouse's employer? And what if they get it wrong? One witness last week laid it out very clearly. They could face a fine up to $25,000. Well, no wonder this law remains unpopular with Americans, with the polls saying 56% of Americans, a clear majority, want to see the individual mandate delayed. Even prominent labor union leaders are now predicting Obamacare will shatter their health care benefits and destroy the backbone of the middle class. So why is the White House ignoring the voices of middle-class Americans? Why aren't they listening to average workers? Well, this is Washington, so we can predict that some will attempt to dismiss these questions by saying it's all just politics, that Republicans are trying for the 38th or 39th time to repeal Obamacare. But remember, it's the White House that delayed this important mandate, not Republicans. Others will claim the employer mandate isn't really important, although in this very committee, they fiercely defend the mandate as one of the twin pillars of Obamacare. And still others will hysterically claim that postponing the mandate will harm children with pre-existing conditions and young people wanting to stay on their parents' plans until age 26. But of course, those laws stay firmly in place. And if we treat workers the same as businesses have been treated by the White House. Today, Treasury Department's acknowledgement that it's not ready for businesses is the first step. The obvious next step is to acknowledge the same problems exist under Obamacare for individuals, and that the same relief should be given to families and workers. That would be fair. Before I recognize Ranking Member Dr. McDermott for the purposes of an opening statement, I ask unanimous consent that all members' written statements be included in the record. Without objection so ordered, I now recognize Ranking Member Dr. McDermott for his opening statement.